Insurance options. As many of you are aware, when a member retires, all of our members, no matter where they work in the state, are eligible for an Arizona State Retirement Plan. That paperwork comes to our office. We process it to the two state agencies that handle the medical and dental, which are United Healthcare and Assurant, or actually it's Sun Life now. And again, the paperwork comes to us. It doesn't go over to Arizona State, even though it is technically their coverage. Arizona Department of Administration is a little different because you actually have to be a state employee to take ADOA as a retiree. So someone who works for the county would not be able to be eligible for ADOA's coverage. So only those state employees can take ADOA coverage. And then the third option that they have is if the group that they are retiring from offers some sort of coverage, whether it's through a COBRA or whether they actually have a retiree coverage. Some of you have dealt in the private plans. We'll talk about that a little bit, but it would be through their employer. So when you're helping somebody who's retiring, just remember if you're not a state agency, that they have two options. They can either go with the ASRS group, and they would get that application from our website or from our office and send it to us, or you guys would help them out by signing them up to get their subsidy for your coverage. All right. Subsidy. That's the big thing that everybody's looking for these days. Each system, the public safety, co-op elected, and Arizona State Retirement offer what's called a subsidy or premium benefit if you work with ASRS. And that is a set amount for different levels. I've got my next slide will show you those different amounts. Subsidy is based on the amount of the insurance coverage type. Like, is it family? Is it single? Some of you may not understand that that means, like, if the member takes medical and dental, their dental they take a dependent, but their medical they take a single, it's still dependent subsidy. It's not single subsidy. So a lot of you have been surprised when you get the dependent subsidy because the dependent was only on the dental. Well, that's why. They could be on either or both. The only one of our groups that has a prorated amount for the subsidy is the elected officials group. If they have 5 years of service, that's when they start earning their subsidy. If they have less than 8, it's a prorated amount from 5 years to 6 years to 7 years to 8. 8 years and over, they get the same amounts as corp and public safety. And what are those amounts? Here we are. The first group is the members not Medicare yet, and that's $150. And I have to remind you guys it's up to $150. So if their premiums are lower than $150, we would pay the premium amount. Not very many retiree coverages are under that amount, but I just like to mention that. A member who has Medicare gets $100. A member who has at least one dependent on one of their coverages gets $260 if nobody's Medicare, moves down to $215 if at least one person's Medicare, and it's $170 if all people on the plan are Medicare. What is considered health insurance? For our purposes only, medical and dental. We haven't really opened up that vision, pharmacy. You know, sometimes people have a separate pharmacy benefit from their medical benefit. We haven't opened any of that up, so it's still just the medical and dental coverages. But on a side note, if your plan combines the two, like a member can only take, like it's a medical dental package, you don't have to separate them out and request them separately. Just, it's one plan, so just present it as one plan. So I've had, I don't know how many of you are familiar with the ER sub form, but it's the employer request for subsidy form, and we have a section for medical and a section for dental, and I've had people break it out, and we have had a hard time trying to figure out what the premium was because we couldn't find it, and then we figured out it's because they were separating it out, and they don't separate it out. So medical and dental were all one cost together, not separate. To apply for the subsidy, if the retiree, the only time he fills out an application to get his subsidy is if he's taking the PSPRS plan, he'll fill out an enrollment form. That enrollment form also will include that they'll get their subsidy. If they're a state member who is going to take ADOA coverage, as you know, if you're a state employee, they can either go online and sign up online, that initiates a subsidy, or they can request a form from ADOA, and once they fill out that form, turn it into ADOA. ADOA will let us know that they're on the coverage, and they get their subsidy that way. If it's an employer's group plan, then the employer fills out the ER sub form. You'll fill it out with the member's name, the information about the coverage they have, the cost of that coverage, and the effective date of that coverage. All right. Yes?
Could you give me a little more distinction between those first two bullet points as far as when the employee gets PSPRS and the employer sends the PSPRS?
Okay, the retiree fills out, if they're going to take the Arizona State group plan,
Okay.
they fill out the application.
Okay.
But if they're going to take their employer group plan, the employer fills out the ER sub form. Okay, good question. There are some times where retirees can be eligible for more than one subsidy. Almost all of us know about that, but every now and then I get new people in there. They're like, hey, I thought the subsidy is only $260. Why are you sending me $520? Well, that's why, because they've got 2 retirements, and both of those retirements that made them eligible for a subsidy. The most popular is they retire from one of our groups, whether public safety, corp, or elected. They go back to work under a state agency and retire from that agency, so they'll get Arizona State's and our subsidy. And it's just easier if we're the ones to send the subsidy, and then we send ASRs a bill every month for the subsidy that we've paid already to you guys as the employers. The new thing I wanted to just kind of make sure everybody was aware of, well, I'll go to bullet number 2 first. For Medicare purposes, we go by age 65, which is on the Medicare website. So at age 65, we send out a letter a couple months prior, and we say, hey, member, we see you're turning 65. If you're not eligible for Medicare, your subsidy will not go down, but you need to send us proof from Medicare. If you're eligible and you just choose not to take your Medicare, your subsidy still will go down. So just know that, and make sure your members understand that just not choosing Part B isn't going to make it so that they don't have their subsidy go down. If they're eligible for it, then it will go down. Okay, return to work. I know that in the big discussion room, talked about a little bit of the return to work rules as far as benefit side. The other side to that is if somebody does retire from one agency and go to work for another agency, they can get their subsidy. You have to make sure that the members met all the rules for going back to work, especially if they're one of your retirees and they come to work for you again. There's several steps that are going to be taken before they can get that subsidy. But again, just to reiterate, the subsidy is up to 150 or up to 260. That means if their premiums are lower than that, we're not going to send the full 150 or the full 260. We're going to send what the premium cost is. So just be aware. I know a lot of employers that have had a lot of people come forward to say that they're return to work. They have actually put it in their forms for hire, asking the question, are you retired? So that they are aware, oh, this might be a return to work guy. It would behoove you if you would just find out from your different employees, make sure that there's not someone. We constantly are getting people contacting us saying, hey, I've been working for this agency since 2016. I didn't know I could get my subsidy. So they're out there, guys. You just have to, everybody has a different way that they've been able to find them, but they're out there. Okay. We have a retired members department, and we as a full department are responsible for the different steps for the insurance. To gather the information from the employer groups about their options available. And how we do that is every year you guys will fill out some sort of sheet, spreadsheet, form, whatever's to your liking that shows me this is what we offer, this is the premium, and then we can plug that into a table, and when the member takes that, we just say, oh, he's taking this, and then the subsidy gets applied to that before it's either deducted, or if they're not being deducted, then we send it to you. And that's a really important thing. If you, the employer, are sending us that ER sub form, on that form, there's two options. There's one that says pension deduction or direct bill. When we're saying direct bill, what we mean is you don't want us to deduct out of their pension because you've arranged for them to pay their insurance in another way. So all we're going to do is send the subsidy to you. So that's why there's that distinguishment on the form. I think sometimes the direct bill, people get confused and think that they're going to be put into some sort of weird direct bill thing. But that's all that we're really saying is that we're not going to take anything out of the member's pension if you check that box. That's all we're saying. We assist retirees that call or come into our office about maintaining their coverage. Sometimes we do get the occasional person coming in with their bills from United Healthcare, wanting us to help help them. We'll sit with them. I mean, we're there to serve the members, and so we'll try to our best, but since we don't have access to the United Healthcare network, we can only do so much. We also help retirees resolve any eligibility issues. Occasionally, especially right now, it's open enrollment, and this is the first month of everybody's new coverage. They're wanting to go to the doctor or the dentist, and they've just signed up for their coverage, and they go to make the appointment. They give them their card number, and they're told, you don't have coverage. So that's what we're talking about with the resolved eligibility. We just make sure that for whatever reason, we don't know why they weren't put into the system. We've sent the application, but it just didn't get entered.
All right, when we get the subsidy checks, there's never really any information on who that subsidy ties to.
There is. So you need to talk to you need to talk to whoever gets that package first, because attached to the check is a slip that says we're paying for this member, this is their last for their social, this is what we're paying. So
I'm the one that gets it, and I open the envelope, there's just a check with a stub on it. Do I need to scan it so somebody can see it? send it to you?
No, because I stuff those every month. I can't stuff them. So you get a backup. I don't know. We'll have to, which organization are you with?
Huh?
Which organization are you with?
City of Wilcox.
Yeah, there's a, and maybe you're just not seeing it, but there's a piece of paper in there, because there's always the check and then a piece of paper.
It's a white piece of paper.
Yeah, it's just a plain white piece of paper.
Okay.
I'll have to pay extra attention
Please
to
look
see
at
what's
mine,
going on. But if
guys.
you email me,
Yes,
I can send you a copy of it, because we have a copy of it.
that would be great.
Yeah,
Thank you.
for whatever months you want, in case it's just one person. And that's the kind of things, you know, you guys can either email our retired members department with issues that you're having, the check's coming to the wrong place, it's coming to the wrong person, you're not getting a check, you can either send it to that, or I have a few business cards, and I think my email's on them. I'm getting old, so I'm doing the stretch thing. Oh, no, my email is not on it. Never mind. My email is just my name, Annette, at PSPRS.com. So, and if you don't know how to spell Annette, that's Annette. So, all right. Is there any other questions on the insurance subsidies? Because we're gonna move on to the cancer. There's not. Nope. You're all pros. All right. This is just set up where. How do I get to the other presentation? Hello? Is it in the files? Where's the file?
Oh, we'll figure it out together.
I'm so used to touch screens. I'm like sitting here. Okay. Well, I mean, we can start talking about it. The cancer program, as you all know, it's evolved through the years. In 1997, it started out with just the firefighters. And then in 2007, they added in the peace officers. And then in 2015, yep, she knows. She's not ready. She's like on me all the time. Hey, I've got this person. Corp came in 2015, and Corp is unique because the other groups, the public safety guys, the firefighters and the police officers, they don't opt for this program. Once they're a member, they're in the program. And so they don't have to sign anything to be part of it. They don't have to do anything to be part of it. They're just part of it. But the Corp members, they have to opt in. Actually, they have to be given the opportunity to either opt in or opt out. And so it's very important if you're hiring Corp people, they have to sign that form. You have to be able to, let them know that that's available to them, give them the opportunity to either accept it or decline it. And the reason why it's important that you do that and you keep a record of it is we've had several times where somebody finds out about the program, they swear they had a deduction for it and they signed up for it. They come to us, they want to submit a claim, and when we check with you all, they didn't sign up. So, they swear they did. So, we don't keep a copy of the claims at our office. We have a program within our old system that I can track people. Unfortunately, with the newer hires, they moved us to a new system. Within that system, we can't track. So it's really, really important that you guys know who you have signed up for that program. Because I'm going to come to you sometimes and say, I need to know who signed up for that. And that's just the Corp. Again, just the Corp people that are doing that. Under the cancer program, there's a $50 per active member annual cost to the employers, which I haven't looked at our charts lately, but I think pretty much everybody's paid We usually have some stragglers in December, but I think because everybody knows about the program, they are on top of it. So if they haven't seen the email, they'll usually contact me and say, hey, I haven't seen my bill yet. So I don't have a problem with that. And then, of course, with the corp, it's a little more intricate because we have to find out from you all how many people were signed up, and then we turn around and kind of do a reversal. You tell us how many people there are, and then we bill you. Instead of we saying, this is how many active people we show for you. Yes?
When are the bills due? Is it like the same time?
For corp, we've kind of been flexible because it's the fiscal year goes from July 1st to June 30th, and sometimes with corp, there's that new, like, what is it? 90-day thing where they can opt into the optional plan versus the DB plan. And so we've been kind of trying to figure out, like, when do you actually give them the applications? So because all that can be tricky, the annual billing for corp, we don't really have a set date on the corp members. But for public safety, we, by statute, have to get you the bill by the 30th. If we don't get you the bill by the 30th, they're usually due by the end of August, and if after August we start charging a 15% fee per month that it's late. But if we don't get it to you in time, then obviously we have to extend that grace period as well. So there's that's something that if you don't have it on your annual budget, you should probably make sure that you've got it on your annual budget to be looking forward to that payment to be made. There's something else I was gonna, for the corp members, because there's that complexity of whether they're enrolled or not, if they have a claim, it's probably best that they contact us, and then we'll contact you if it's not obvious, if they're not in the old system and we can't see that they actually are signed up. We'll contact you and say, hey, we can't tell you because of HIPAA rules why we're contacting you, but so, but we'll contact you to find out if the member's enrolled and when they were enrolled, just to make sure. The benefits under the plan are a set amount of benefits. So I think out there's been a lot of confusion. People think that it's any out-of-pocket expense for cancer program, but it's not. There's a set amount of benefits that are available to the members, and so sometimes we'll get people a little frustrated because they'll send us this huge packet. I'm not kidding you, I got one this thick one time of things because they were cancer related, and not even half of them were payable because they didn't fit any of the benefits into the benefit schedule. So it's really important that you guys, as their leaders, that you get on our website, that you look at the cancer part of our website, see what's available to the member. There's a couple benefits that they normally wouldn't get payment for through their regular insurance. One of them is they get a daily confinement benefit when they're put in the hospital for their surgeries. And there is an experimental benefit that as long as the treatment is an accepted treatment through the American Cancer Society or is accepted through the Food and Drug Association as a acceptable treatment to cancer, then even if their regular insurance won't pay for it, the plan does make it payable to the member. And so, really important. The other important thing is I can't tell you guys, I can't stress to you guys how important it is that you make sure that people know about the program. Every day I get calls from members throughout the state who say, I didn't know about this program. I had cancer 3 years ago. Just make sure that everybody knows about it. I don't know, send them a text, send them an email, put it up in your lunchroom area or common area. Hey, did you know? If you want us to come up with some kind of, publication, talk to Christian about it and his department to see if, there's something that he could create for you guys. But just make sure people know about it because it's really hard because there is a 24-month period and we've been really, really gracious in allowing people, but we're getting ready to send out a mass mailing to everybody who is eligible for the program. Once they have that notification, they can't give us the excuse anymore that they didn't know about the program. So be aware about that and make sure that you're getting the word out there. And make sure that you know each other's, because a lot of times it's someone that's still working and they don't know and they're going through all this stuff. I mean, it's been in the news a lot lately with some firefighters, that they've had cancer, and just make sure that if they're submitting for things that you make sure that, hey, have you contacted public safety yet? Just, make sure that they contact us.
You may have said this already, but the benefit is available while you're actively employed and as a retiree?
Right. And as a retiree, you get 5 months for every year of credited service. So this little calculation is going on to where they don't pay for it. If during that time period they have cancer, then they can have the option to start paying for it at $50 a year, whatever the annual rate is at that time. They have the option to continue the program. One thing that you may or may not know is this last passed legislation, anyone who from August 30th forward that retires from the drop program, they get that extra time added to this calculation that they were in the drop. So if they're in the drop for 5 years, they get that 5 years worth of extra time where they are not paying for the program. Now that's for public safety guys. For corp, they always have to pay for it. But if they haven't had cancer, that time clock is still there for them for that 5 months for every year of credited service. It's just if they contact us and they haven't exhausted that time period, then they'll have to pay the premiums back to when they retired forward. So, and the other thing that's important to remember about that, I'm doing this all off the top of my head, so if they had opted in when they retired, that's the time clock, okay? If they hadn't opted in, they're done when they retire, all right? So very important to know that because the public safety guys, since they don't opt in, all of them get that 5 months for every year of credited service when they retire. But the corp guys, they have to have been opted in prior to retiring if they want any options in the future.
So I'm a newly hired employee under PSPRS, and 2 years into, or a year into my employment, I have a diagnosis of cancer. Is there a waiting period for this benefit to pay?
No, it's pretty much the day you were hired. So, I'm trying to go through the slides in my head. So we went over the annuals, sending in. Turnaround, is difficult because we do not have dedicated staff that only do the cancer program right now. And so months like this where we have a slew of people retiring, we just went through an aggressive open enrollment with Arizona State, so we have a lot of work with that. Sometimes they can go a little longer than we usually will before someone gets paid. So it's okay though, if they contact you and say, hey, I submitted a claim for public safety and it's been 3 months, I haven't seen a payment, contact us so we can look it up and see what's going on. We would rather that you do and the member get taken care of.
So public safety, those who retire, then they have, if they retire with 20 years, they have 5 times 20 years worth of free months.
It's 5 months for every
So
year.
5 times the 20, that's how many months they have. Then when that ends, do they get some kind of notice that says
Yeah.
if you want to continue? Okay.
Yeah. Yeah, and we send out 2 different notifications. One, if they have submitted a claim, we tell them, hey, you're coming to the end of your free period. If you want to continue because you have made claims, here's what it costs to go. If they haven't made any claims, then we still tell them you're coming to the end of your period. If you've had a diagnosis of cancer, contact our office. That's our indication to them to say, hey, let us know. You had a question first and then we'll get you.
You said the $50 annual fee for the fifth individual commercial hospital. Once you sign up, is that automatically withdrawn every year, or do you have to resubmit every year?
No, they don't have to resubmit, but you guys would work out the payment. You take the payment we don't take the payment from the member, you do, and then you just tell us how many people, and we bill you for those people.
Okay. And then the other question is, once you submit the claim, say you say you have a cancer diagnosis and you submit the claim, and you get a payout for that, and then you go into remission and it comes back again, are we starting all over again, or is it one-time payout?
Well, that's a good question. Our board is still trying to decide because it's $100,000 benefit total, that's the max you can get from it. And so we're having conversations, the board is trying to reach a determination whether someone can get the first diagnosis, which is the $15,000 payment, more than once. So.
Yeah, we've had this. You get diagnosed with one set of cancer,
And then you
get
get
skin cancer, and then you 6 months or 8 months or a year later, whatever it is, you diagnose it as a different type of cancer. When you read the pamphlet, it says cancer. It doesn't say.
Well, there is a separate skin cancer, just so you know. The skin cancer has a separate benefit, and you can get that up to 5 times. But the big one, the $15,000 one, that's the one that it was traditionally only got that payout once. But, we're discussing that with the board because, people aren't getting to the 100,000, so.
So the 100,000 is a lifetime?
Right. Okay.
For the court members that have to opt in or opt out, is there a time limit from the time they're hired that they need to do it within a certain amount of time?
Well, it says 30 days.
Okay.
But the revolving question has been with the new 90-day wait. Do you wait till the end of the 90 days or do you do it right when they're hired? We've kind of gone back and forth with both. So as soon as we for sure say, no, it's all this, we'll let everybody know. But I think you were first and then you.
A question about skin cancer. So
Yes.
the member goes in and has 3 separate spots that have to have procedures done, those 3 separate claims.
Right. Right. So they'd use up 3 of their 5 diagnosis claims.
I'm sorry, you talked about the drop years being contributed to the years of service?
Yes, but only for members coming out of the drop from August 30th forward.
Okay, so if they retire after August 30th, but they've been in drop, now that's where I'm confused.
Yeah, if they've been in drop already.
Okay, and they
Yeah.
retire today,
Yeah.
then they're eligible for the 5 years. Okay.
On your core guys, let's say the guy goes in at 21, goes into core, and he's gonna live forever, he's never gonna have a disease, never gonna die. But then 10 years down the road decides, I was kind of silly, maybe I should have gotten that. Is there any option for him to start it at that point?
Yeah, each year you guys can offer up an annual offering to members that didn't opt in the first go around, or second or third or fourth or fifth. And if they want to come in at that time, they just need to understand that they're eligible for any benefits from that point forward. So like, say they had cancer in January, they didn't sign up, so now they're going to sign up because they had cancer. They can't go back and get claims on that January diagnosis. But now that they've had a diagnosis, they might still be doing treatments, and they could get the other benefits that are within the program. I think my 15 minutes was up, but we've got 5 more. Woohoo!
Is the annual auction anytime the employer wishes it to be? So can I do the annual auction?
I would say because you want to try to get your payments for the court around the same time as the public safety, which is the end of July and paid by end of August. I would probably do it May, June. Yeah, that's, and they send out like a little flyer. DOC sends out a little flyer to everybody to say, hey, but be careful of saying annual using the word enrollment, because enrollment would indicate that they have options to opt out, and they can't. So make sure you don't use that word. You can just call it offering or something other than enrollment, because enrollment means they have an option to opt out.
You said the employer cost is only $2 per employee annually.
Yeah, and that's, and when the individuals get to that expiration as a retiree and they can continue the coverage, they'll just pay the same amount, $50 a year, which, shoot, I had Aflac, and I was paying $50 a month.
Yeah.
So I was like, wow, I wish I could get that benefit. I saw it in hand, I think.
You went to the 90-day thing for the PSPRS. Do we need to go ahead, and he's not contributing yet to the PSPRS because he's still in his...
Well, the PSPRS is different because they don't opt in.
So is it, it automatically
They're just
enrolls
in,
him?
yeah,
Okay.
they're just in. But that's a good consideration about the court thing, because like, what if he gets cancer within that 90 days?
Right,
So
how do we...
we're leaning more towards you do just from the day you hire them 30 days.
Okay.
Because if they get cancer before that 90-day period and you haven't allowed them to opt in, then there's that gray area.
Right.
I'm just new to that. I just want to clarify, we're talking only about full-time 40 hours.
Yeah, contributing members, yes. Yes, so anyone who's an ASRS member, no. We haven't had obligations for Nancy.
I just want to say, Annette, you're a rock star. You are so responsive, and so I just want to say thank you for everything you do. We'd be lost without you.
It's really important for us, to get back to you guys immediately. So especially me, like an email, if I see an email, I try to do even before a couple hours. So if you haven't heard from me by the end of the day, then there's something going on. So either I'm out, I had to leave early, who knows, I'm tied up in the lunchroom.
I heard you say there was something different with the skin cancer, but is this coverage for any cancer?
Any cancer, yeah.
Public safety employer, when I received the invoice, it's just a number of employees. Is there any way that we can?
Well, no, we send it. We have to send it in 2 emails because of the complexity of trying to do group sends.
Okay.
There always should be an email with the employee list too. So if you don't get that, I keep a folder. You can ask Robert. I drive IT crazy because I have all this data in my system. Yeah, so if ever you get the bill but you haven't seen the employee list, just say, hey, can you send it to me again or whatever? And I'll be glad to do that because I always keep it. And I have I finally, they made me clean out my folder. So I only have it from 2012 forward. We're supposed to mail them by the 31st of July. So this year we had a lot of worky things happen, so I didn't get the billing out until like I think the second week of August. It was into August anyways. And so we extended the time period for you to respond because of that. All right, well, thank you guys. You've been awesome.